How are you?
Good. We don't know what we're doing here.
All right, okay. Can I say hi to everybody? Hey, hi. I'm Raj.
We're figuring things out too because this is the very first episode.
Excellent.
Hi, I'm Dr. Austin Chiang, and this is Spill, a show where we uncover all things about your health, bust common health myths, and spill the latest on technology and how it's working to support different areas of the human body. Today, we're talking about the incredible things that take place in our gut. Have you ever stopped to think about what really happens during the digestion process? Joining me on today's episode is Raj Thomas. Thank you for being here.
Thank you for having me.
I'm excited to delve into the fascinating way our gut works, and we'll explore the latest expert insights to better help you understand what kickstarts the process and gets you motivated to optimize your gut health. So, first segment's what's brewing, yeah? Do you drink tea, by the way?
I drink coffee, by the way.
Oh, okay.
Black.
Well, you're going to have to deal with it. By the way, in full disclosure, Raj is my boss. He's the president of Medtronic Endoscopy, and endoscopy means procedures that go through the mouth where we can investigate our gut.
Cheers.
Cheers. I love this.
To the first episode.
Very nice. Well, I'm actually interested in learning a little bit about how you even got into this space, healthcare in general. What led you here?
So I started in a couple of weeks, it'll be 24 years.
Wow.
Yeah.
And how are you liking it so far?
Well, it's been 24 years, so it's been great. It's been a fantastic journey. I moved into R&D. I was running their animal facility for a while. I did a lot of product development before I came to Medtronic, and then I've had different disease states, right? Cardiac rhythm management, electrophysiology, pelvic health or sacral neuromodulation, LVADs, right? So the MCS business and now endoscopy. So, and in different roles, it's been great. If you think about other things you could have done, and I can't think of anything that would have been better.
I mean, there's so many different ways to impact healthcare, and I feel like clearly you've made a huge impact, and look at where you are now. It seems like it's turned out just fine.
It did turn out okay. I mean, some lucky breaks along the way, right? Some opportunities that I took, but even if those things hadn't been landed me where I'm at, I would have no regrets.
We're going to move on. Okay, good. All right. So now we're going to do a little activity on getting to know you a little bit better, this or that. So I'm going to ask you like one or the other, and you write down which one you prefer.
And you do too?
Yeah, and me too.
This will be interesting.
Yeah. Prebiotic or probiotic? Ready? 1, 2, 3. Probiotic. Okay. What's the reasoning behind that? Why do you prefer that?
I think it's what I take at home.
Does it make you feel better?
I have no idea.
Why do you take it? Do you have
Because somebody said that I should.
Okay.
Right?
That's a good response.
It's just, I just feel like people, I don't know if it's actually a pre or I'll check tonight, actually. I take it at night. I take it with a piece of some magnesium and a vitamin D.
Oh, so you kind of do both, because prebiotics are basically fiber. Basically, it's like what feeds the probiotic kind of bacteria. And the fact of the matter is that, we have very little understanding of the benefits of both and exactly like when to use it for what reasons. So there's very few conditions where we actually recommend, certain probiotics, but, some
Should
people,
I be taking it?
Well, some people find benefit, from it, like for some of their symptoms like bloating and whatnot, but sometimes it can make things worse. And this space isn't very well regulated the way medical devices are, for instance. So you kind of have to be careful, even though there's a lot that's available on the market.
All right.
But okay, very cool. In-person or video calls? This is very relevant to, our current work climate. Ready?
Yep.
3, 2, 1. Same. Okay.
Give me a reason.
I mean, there's just something about virtual calls. You can't really foster like a true connection without reading people's body language and being in the same space together. I don't know. What do you think?
100%. I think what I found when COVID hit was you couldn't have the 3-minute conversation in the hallway, right? I only need to talk to you for 3 minutes at best. I can do that on the way to my next meeting. COVID, it was like, all right, I got to schedule a meeting with Austin. It's a 30-minute meeting. Who does 15-minute meetings? You can barely, and you haven't seen the person, so you want to check up. Yeah. It's not as personal as you say, right? And then I think when you're together, beyond the 3-minute work conversation is how are your kids, or how is your family? How are those things going? What's going on in that gives you that connection? It might be even a meal, right? If we're having meetings in person, all day meetings, somebody's going to eat. We're apparently going to have dinner, right? So you can have that. And there's another sort of personalized, so it builds the relationship better, I believe. So,
and that's like a shared memory. Like, how often are you going to remember a Zoom call?
When we were in COVID, I'd be like, I had a conversation with somebody. I have no idea, because my guest room, desk, and video camera were the same day in and day out, right? There's no change. There was no sort of environmental cue to lock onto.
Yeah,
right?
That's a great point. Well, on that note, we should cheers to that with our tea.
Yeah, we're in person.
It's time for my favorite part of the show, Spilling the Tea, a segment where we bust common health myths, look at news headlines and social trends, and tackle common misconceptions. Let's get into it. It takes 7 years to digest gum. Have you heard of that before?
Oh, that was why my parents, if I was given a piece of gum when I was in the 1970s, don't swallow it because it's going to take 7 years, and they didn't want me chewing gum. So we're going to go, that was what I was told in the 70s, so it must be true.
It's something I think that people often talk about, but it doesn't actually take 7 years. I mean, it's not a great idea to swallow chewing gum anyway. So, I mean, just don't do it.
I don't chew gum.
Ulcers are caused by spicy food and or stress. What do you think? Have you heard that one before?
I've heard both. I'm going to go with not so much on the spicy food, because there are whole continents of people that eat very spicy food, including, family members of mine, and they don't seem to have ulcers. On the stress side, I don't have anything I've heard that's true. So maybe. I'm not sure.
Yeah, I would agree. I mean, spicy food, I love spicy food, and I haven't had an ulcer to my knowledge yet. So, and I like spicy food so much, like I like it when I'm crying and sweating.
God, you like my dad was. He's sweating. He'd like, oh.
Yeah. I like, it's a little, masochistic, I guess. But stress, I feel like stress, there's certain types of stress, like physiologic stress, like from disease and whatnot, that could, lead to an ulcer in the stomach. But usually it's not because of that. It's like, taking certain types of medications like ibuprofen that can really wear off the protective lining of the stomach and cause ulcers. There can be bacteria like H. pylori bacteria that very common around the world. Millions of people have it, and that can lead to ulcers and just needs to be treated with a course of antibiotics. But yeah, these two causes, not so much. All right, if you don't have, this might be a little TMI, but if you don't have a bowel movement once a day, is there a problem? And you don't have to talk about your own habits, just in general.
I feel like it would be, but because the transitory cycle is something like between 12 and 18 hours or something like that, right?
It varies. I mean, from person to person, it's it's different for everyone. I'd say that the general idea is that anything more than 3 times a day or less than 3 every 3 days is an issue, but it's normal if people don't go once a day.
Okay.
Yeah.
All right. Not my issue, as it turns out.
Not your issue, apparently, which is good. I like to hear about regularity. A colonoscopy is only used for cancer screening.
Colonoscopy certainly is for cancer screening, but if you're to remove a polyp, it's also a colonoscopy. Yeah. So it's also, not only is it screening and diagnostic, there is a treatment piece here, right?
It's therapeutic. It's like a therapy.
Yes. Yeah. Because the colonoscopy piece is just the actual physical of putting a tube right through the colon. Yeah. And then what you do in there, right, whether it be screening or treatment, is still part of the colonoscopy.
Absolutely. And there's a lot of other reasons why we have a camera, take a camera and, look around the colon. I mean, sometimes it's for diagnostic purposes. Some people have abdominal pain and we can't figure out what it is, or they have other symptoms like bleeding and we need to go searching for where it's coming from. And so, sometimes it's to diagnose, something like inflammatory bowel disease or some other cause or of bleeding or symptoms like that. So yeah, not just cancer screening. You're right.
I'm learning.
Well, you mentioned that you had gotten one before. So is endoscopy painful? And endoscopy, by the way, is just like a term that encompasses all scopes, like whether it's from above or below. So is it painful? What was your experience?
I had a great nap. So on the colonoscopy side, no, but I was asleep. As I understand from what you guys have taught me on the EGD, so the endoscopy side, some of those you are actually awake for. So it may not be painful, but it may be just uncomfortable.
Yeah, I mean, I think in most situations these days, we're giving medications, which are really great to help people be asleep through the whole process so they don't remember anything, don't feel anything. In some parts of the world, some of these are done unsedated. And, it can be done unsedated. So in situations where you can't use kind of these sedation medications, you can still do the procedures. It's just less comfortable.
Yeah. So it's not painful. It's more of a discomfort.
Yeah.
I'm not going to try it. Just to be clear.
Colon cancer screening is only for older adults.
No, false. Or partially false. So no family history, 45 and above, get a colonoscopy, get it screened. Family history, you need to start earlier. I'm not sure if there's an age.
Yeah, that's right. It's
30?
like starting at 40 or 10 years before your family member was diagnosed. And also other very specifics like conditions where you have to start even earlier. If you have like an underlying genetic kind of polyp disorder, then you might have to start even earlier than that. But yeah, that's true. All right. Now it's time to switch gears and dive into the world of innovation. Welcome to Tech Time, where we explore the latest advancements in healthcare technology and how they're transforming the way we live and thrive. Join me as we geek out with our experts and uncover the latest trends and breakthroughs in health tech. Pardon me. A medical breakthrough that instantly comes to mind. Instantly? All right. Ready? Oh, okay.
Right. So AI assist colonoscopy.
And I wrote AI. There we go. I mean, I feel like, yes, AI assisted colonoscopy, because that's like what we have. And, it's super relevant. It's a great example of it being used in healthcare these days. But AI in general is just like, there's just so many ways it could impact, both health outcomes and also like our efficiency and how we actually deliver care. I don't know. What are your thoughts?
There are sort of two major pieces that we can address at the moment, right? And that is patient outcomes, right? So just higher detection, of polyps and right. And then there's the efficiency of the procedure. From the moment you sort of consent the patient to the moment you've done the documentation, how can we make you more efficient? So on the first piece, in patient outcomes, you're also you're improving outcomes by higher detection rates, which are lowering human error in a way, right? Mm-hmm. And then the other one is just making you more efficient during your procedure. Yeah. So you can spend more mental capacity on actual care versus the documentation and all the other things that go with the procedure.
Very true. So, I mean, it's so cool. Like this image processing and applying AI to an image is something that's almost seems obvious to us now, right? But there's so many other ways that AI is being applied in like drug discovery, in like helping generative AI, potentially like helping us write helping us document. Like it's a huge area of frustration for doctors to like sit there and type and like deal with all the administrative stuff that maybe AI can help us out with one day. So
we're betting on that a little bit.
I didn't think like maybe 10 years ago or whenever it was when I was like in med school that this would be, the big topic of interest in healthcare these days. So yeah.
For sure not me when I started.
I mean, who knows? Like it kind of makes me think, where are we going to be in like 20, 30 years? It's exciting. If your gut could talk, what do you think it would say about eating habits?
All right.
Ready?
Yikes.
Need to improve.
Need to improve.
I mean, there's a common saying that doctors are the worst patients. And I mean, there's a lot I could improve upon for sure. So, and sometimes, especially with how busy we are, we kind of just do what we can, right?
Yeah.
I don't know. What do you feel like you need to improve most upon?
I got into the habit over the last 12 months to eat a higher protein diet. Just helps with like fat loss, whatever. Just being a little bit
low carb, high protein.
Yeah. And but I don't eat vegetables. Well, I do when they're served.
Raj.
I'm not a big vegetable fan.
Oh no, why? Just not your thing. Yeah.
I mean, great. Like, I mean, I'm fine when you roast them and there's olive oil and salt and those kinds of things. Sure,
but not a salad guy.
No, I mean, no, that's just a bunch of leaves.
Yeah, raw vegetables. Yeah, are
raw?
Tough to. Yeah,
not a fan. So that's where I could improve.
Eat a balanced diet, everyone. We like, high fiber, rich in fruits and vegetables. Protein's good, less starch. I don't know, that's usually what I tell everyone. Yeah. So on to some more focused tech questions. So how do you believe virtual augmented reality will transform endoscopy when it comes to training and education for health professionals?
I think the simple answer is it very well could transform the way people are trained, right? We saw a little bit of this when I was in pelvic health. We saw some augmented reality stuff or virtual reality. You're not using a person to train on, and that person's probably grateful, right? So there's things that you can do more repeatedly, faster, more and more times that would make you more skilled going into whatever procedure it might be, whether it be an endoscopy or otherwise, right? So I think it could very well transform.
That makes a lot of sense. Yeah, I was thinking, I didn't even think about that. Like people can learn at their own pace,
right,
or repeat kind of learning when they need to, and not rely on somebody there to train them physically.
It would make things, to your point, a lot more efficient. People would actually be able to do it on their own pace. They would probably feel a lot more comfortable going into the first procedure, right? The human body, very different, obviously, but you could, more and more of the sort of the AI pieces of it would allow you to have more diversity in your training experience.
How do you see the role of endoscopy evolving in the diagnosis and treatment of chronic diseases?
When we think about detection of disease states, AI will help. So we have to figure out which disease states you can do that. I mean, so colonoscopies, colon cancer, very good example. What other places can we do that? Because I believe that we will improve patient outcomes when we reduce human error. And human error sounds terrible. It's not that so much as that there's so much going on when you're doing a colonoscopy. How are your eyes going to be able to detect everything after the 10th or 15th one during a day, as the example, right? So I think we in endoscopy can be out there with the AI aspect of it to help with the diagnosis and then subsequent treatment of these disease states. Now, what we do with AI afterwards, when you go into different spaces within the company, I think it's kind of the same principles, right? How can we change patient outcomes?
Yeah, it makes a lot of sense. I actually also like getting back to the whole patient centricity aspect of things. Like we have a new product iteration coming out where there used to be for the capsule endoscopy, the camera that's shaped like a pill that patients swallow, and it takes pictures along the way. To record those videos or those images, you used to have to wear this whole bulky recorder thing, and now we're simplifying it, and it's just going to be a patch. And that's just another example of that often we use that for certain chronic disease monitoring and whatnot, but it's just for patient comfort and improving the patient experience too.
Well, and then when we go to our step 3 with the AI aspect of it, it's not going to cut down time for the physician to read that recording. The recording takes 30 to 40 minutes to read today. If we can cut that down to 10% of that, that's fantastic. That one, it helps with diagnosis, then subsequent treatment, because it would be separate in this particular case, but it also frees up the physician to actually put critical thinking into the care, right?
Yeah, that's the important piece. Is you're freeing up time. I think that's why when you improve the efficiency for the doctor, it frees up time for them to treat more patients, to treat more carefully. Yeah, so that's the importance behind that. And that's a wrap on today's episode of Spill. Thanks for joining us on this journey into the world of health and technology. We hope you enjoyed the conversation and learned something new. Don't forget to tune in next time for more myth-busting, tech talking, and tea spilling. Special thank you to our guest, Raj Thomas, for sharing his insights and expertise with us today. Until next time, stay curious.